So topic number one regarding chronic obstructive pulmonary disease or COPD might be, what should I expect from my clinician visit when I have COPD? And first of all, you want to make sure that you have COPD. You want the correct diagnosis. That means spirometry. What that entails is very simple, going to what's known as a pulmonary lab, which can be a very small space. Even some primary care offices have them, where you breathe into a tube and you want to give maximum effort. Then you get a dose of a bronchodilator, usually albuterol. That's just an inhaler. And then you breathe in a tube again. That's simple. But also, I recommend a chest x-ray. That, with your symptoms and your history and your physical findings, helps make the diagnosis of COPD. But without that test called spirometry, breathing into a tube, you can't really make a diagnosis of COPD. So you want to make sure that you have that. Instead of just having, if you notice you have 3 inhalers around and people tell you, yeah, you might have COPD or emphysema, which are interchangeable terms, go get spirometry done. The other thing I would really want you to do is get vaccinated. Vaccines are really important in COPD because as your lungs gain greater amounts of dysfunction, you're more at risk for viral infections, RSV, influenza, COVID-19. And you want to make sure you get a pneumococcal vaccine. So that could help prevent pneumonia and invasive bacterial disease, which can be really terrible. So understand that there's ways to protect yourself. Triggers in COPD. The number one is smoking. So if you haven't heard about smoking cessation, we have great tools available, and really talk to your clinician about using some help. There's also national and local programs that help you quit smoking. It's one of the toughest things you could ever do, but it's by far the best thing you can do for your health overall. So that's number one. But also watch out if you work in dusty or smoky environments. If you're working with a lot of chemicals, make sure you wear a respirator and you take the appropriate precautions, because those things can make COPD worse, not only day to day, but they can actually lead to long-term damage that results in more problems down the line and worsening lung function, which is what we want to preserve. Overall, you want to work with your clinician to protect those lungs as much as you possibly can. And those are some of the simple ways to do it. Of course, treatment can help too, which I'll address in a different form. So as a primary care doctor, I'm pretty heartened by the options I have to treat COPD. I treat COPD regularly in my practice, and most of my patients are under good control. And when I say control, what I want are a couple things. I want to maximize their function and have people be able to do whatever it is they want to do. Now, sometimes that's not possible. If you have severe COPD and you want to run a half marathon, that's probably not going to happen. But most folks are pretty realistic. They just want to get to their job. They want to get to the store and walk through the parking lot and not be out of breath. They want to go to the park and play with their grandkids. All those things, if it's a goal for you, it's a goal for me as your clinician. I want to try to help get you there. The other important thing is I want to avoid getting you getting an exacerbation as a patient. Exacerbation means that your disease is more severe. Maybe a respiratory infection sets it off. Maybe you get exposed to an allergen or some other irritant that causes a problem in your airways. But we really want to avoid those situations when possible. And when you get into that situation, treat you appropriately. So the most common way we treat COPD with medicine is through inhalers. And there's a variety of different inhalers available. But most folks with COPD, you want to use a regular controller inhaler. And I see far too many people just using an as needed inhaler for when they feel out of breath, even though they're using that every day, every other day. That's far too often. It means you're not getting to the function you want. You shouldn't need a rescue inhaler that frequently. The problem with that strategy, for one thing, is the more you use the rescue inhaler, the less likely it is to work. So if you use it for mild symptoms, say you do get an upper respiratory infection and now you're having severe symptoms and you can't breathe, and you try that inhaler again, it's not going to be as effective for you, and you wind up in the emergency department, which is what you don't want, and I don't want, nobody wants. So I think that we underuse controller drugs. These are very safe. They're well tolerated. They generally don't have any side effects. They work in the large airways and the smaller airways. And so I prefer to use long-acting muscarinic antagonists or LAMAs. There's also long-acting beta agonists or LABAs. And what's even better is when you combine those two together. It's called a LABA LAMA. Which is fun to say for one thing. And then another thing is that they're really effective. So they improve your symptoms. They improve your function overall. They improve that breathing test you do called spirometry, and they can prevent exacerbation. So they're really outstanding. And I find that because they're so well tolerated and they work over time, that's a really preferred treatment. So if you notice you're using inhalers and you're not getting what you need, particularly if you're just using them occasionally, try to talk to your clinician about getting on a controller drug that you use every single day. That will probably get you much better results. And in terms of side effects and long-term use, they're very safe as well. Everybody with COPD should also get a blood test. Why do you need a blood test when you have COPD? Well, we want to check something called the eosinophil level, because if you have a high eosinophil level, you might respond very well to adding what's known as an inhaled corticosteroid to that LABA or LAMA. And some people take all three if they have more moderate to severe COPD. The corticosteroid is really nice because it can help prevent exacerbation. It's very good at that. It can also improve your function and your exercise tolerance. So that's really good as well. It does come with a little bit of a downside potentially. There is a slightly higher risk of pneumonia, but for patients who need it, their improvement in terms of risk of exacerbation, even the risk of death, is improved by taking a LABA LAMA and an inhaled corticosteroid versus a LABA LAMA alone. So when you need that inhaled corticosteroid, definitely use it. It can keep you out of the hospital or even worse. But that's when you have more moderate severe COPD. And that's when your clinician can help navigate that with you. I think the only other thing I would say to round out this section would be these medicines, these inhalers, are only effective if you use them correctly. So there are a lot of online videos about how to use your inhaler correctly. They're not branded to specific companies. They come in a bunch of different languages. Your clinician should be also able to show you how to use your inhaler, but you have to work on your technique. As somebody who has mild asthma, I know the difference from when I didn't know how to use my inhaler versus using it correctly, and I could feel the difference. And so make sure that if you're taking the medicine, take the time to use it right and know what your medicines are. It's also incumbent upon your clinician not to give you too many inhalers, so you can recognize, here's my controller one, here's the ones I might use if I need something for an urgent situation. Most cases of COPD can be managed in your primary care office. So if you're seeing a family doctor or an internal medicine specialist, whomever your head doctor is, that person could do the management of COPD, because most cases of COPD fit into a mild or a moderate category. There are some symptoms, but those patients aren't going to the hospital all the time. They're not getting admitted, and generally they're able to have fairly full function. Once patients move into a severe category, I do think about referring and co-managing. Now, I'm still involved in the patient's care. I'm doing the important work of maintaining their inhalers and giving vaccines, and the day-to-day stuff. And also, there might be other conditions that exacerbate COPD, like obesity or gastroesophageal reflux disease. I'm treating those. But there are some more special medicines and an increasing amount of special medicines for folks who have more severe COPD. So that's either really significant symptoms that are really dragging down their quality of life, or they're frequently exacerbating. They're going to the emergency department more than a few times a year. They're getting admitted twice a year or more. You might see a pulmonary specialist. And those folks do have access now to an increasing range of treatments that aren't inhalers. So these are biologic treatments that can go after inflammation and attack it. So that with one of the main goals being keep you out of the hospital, keep you out of the emergency department. And if you've ever been to the emergency department for an acute issue, if you've ever been hospitalized, you know what a drag it is. And I would just point out that every exacerbation of COPD leads to more exacerbations. So it's not just like, hey, well, too bad, I got the flu and I had spent 3 days in the hospital. Boy, I had a really hard time breathing. I needed masks with oxygen, or I was intubated for a couple days. Unfortunately, there is harm, permanent harm done to your airway with that. So that means it's easier to get another exacerbation. That's why I want to work so hard on the preventive aspect, stopping smoking, avoiding triggers, good controller inhalers. But yeah, unfortunately for some folks, they do have more severe COPD. They do need to think about these biologic options. And that's something that really is still in the world of the specialists. Together, we can work well. And I would just encourage you to encourage your clinicians, the people you're seeing who are taking care of you, make sure they're communicating, because nothing's worse than when the right hand doesn't know what the left hand is doing. And that can actually put patients in danger. So you really want to encourage communication, and you as a patient can be the linchpin that puts that together. So take some notes. What did the doctor say? What did they recommend I do? And then you can share that with the other clinicians. So I don't think that that's asking too much, but it's really empowering. One, it's going to help you to understand your disease a lot better, because it's hard to remember what happened at that pulmonary specialist visit 4 months ago. But yeah, with a few notes, I think that that will help you and can help your clinicians and make your care a lot more efficient and effective. Thank you very much for taking the time to watch these videos. It was a pleasure to do. Hopefully you found them helpful. And beyond that, I really hope that you feel more empowered in taking control of your own healthcare, because really at the end of the day, that's what you want, is patients who are informed, empowered, and trying their best to be healthy. If you are interested in more videos, please go to the exchangecme.com website. Subscribe there, and we'll see you another time. Take care, everyone.